Spring signifies a lot of things, from flowers blooming to finally getting to your spring cleaning.
But something you need to do all the time, and especially now, is to make sure your health is in tip-top shape. Joining us for more information in this sponsored interview is Elizabeth Passion, Director of Clinical Pharmacy. Welcome. Thank you for being here.
Thank you for having me.
Such an important topic. Why is breast care so important to keep learning about and keep up with?
Well, breast cancer is the second most highest form of cancer in women, second only to skin cancer. So not only do we need to protect ourselves from the sun with sunscreen and long sleeves, but we need to make sure we're screening ourselves for breast cancer, getting mammograms.
Unfortunately, the numbers in Utah specifically are lower than the national average. Why, and what should we be doing about it?
Yeah, Utah women are screened 8% less than the rest of the nation. And I think there's a lot of reasons why this could be happening, including sometimes we put others before ourselves, and maybe that's not the best approach, but really knowing that we should be getting screened is the most important thing to do, and that's exactly why I'm here today. We need to talk about education of who should be screened, and then also making sure that we all have access to screening, and that's how we're going to fix that 8% gap.
Oh, that education is so important. That was something that I didn't know until just a few moments ago, that we're below that average. What are the common symptoms of breast cancer that women should be looking out for, being aware of?
Yeah, a lot of times, unfortunately, breast cancer is happening and we don't know it because there aren't a lot of triggers or a lot of symptoms. But some people can, it's painless most of the time, but some people can have a lump in their breast or under their arm. They can see some changes in their breast, the way the skin is, or the redness, or different area, if it's changing. So those are definitely signals to make sure you reach out and talk to your provider about getting screened. But the general population needs to be screened too. As we age, our risk of breast cancer goes up. So women over the age of 50 are more at risk. So we start screening patients at age 45 and above to make sure that we have annual reviews of those, because the best prevention is making sure that we get screened. So that's why at Optum we have a mobile bus, and that mobile bus has an onboard mammography. And you may see it, it's huge, it's orange, it's running up and down I-15, and we put it at different places. Sometimes it's at a local PCP office or your provider's office, or sometimes it's at a Walgreens, but we schedule clinics so our patients can get a mammogram and other screenings on those buses. So we can improve our access, and that's how we do it at Optum.
Well, mammograms, as we know, save lives, and so we do need to get that annual checkup starting at 45. But if people have a family history, what should they be doing?
Well, you definitely need to have a conversation with your provider about when's the right time to be screened. I was reviewing these statistics this morning, and if your family member had a certain age, that you should probably be screened 10 years prior to that. But we just need to make sure we have those conversations, know when the right time to be screened is, know what the risks are for you and your family member. Have the conversation with your provider to make sure that you have access to what you need when you need it.
And starting at 45, I'm glad that you looked that up. You're telling us that because I wasn't sure. I said, I'm nervous, I haven't done it yet, but I have some time, a little bit of time. How do we reduce our risk in the meantime?
Yeah, well, we need to make sure that we stay as healthy as possible. So staying active, staying healthy, make sure you know when hormone replacement therapy is appropriate or isn't appropriate for you. Having those conversations with your provider is the best thing to do.
And for more information and where that mobile unit will be, you can always jump on your website.
Yes, absolutely. Yeah.
Okay, we'll put that information on your screen right there and also on our website. Thank you so much.
Thank you.
Thank you.
And thank you again to Optum for sponsoring this interview.